Adam, State Representative Adam Zabner. He already checked in a couple minutes ago. Adam represents House District 90 out of Iowa City in Johnson County. And I'd like to make a note that Adam is the only elected Democrat who's a Latino, either in the House or the State Senate. So with that, Adam, I'm going to give you the first 6 minutes to talk about yourself and your campaign. Patrick will ask you a couple questions over the second 5 or 6 minutes. Then we'll give you a minute or two to close it out at the end. So Adam, are you with us?
I'm here. Thank you so much for having me on and for your support last time for my campaign. Two years ago now, I ran for the state legislature for the first time. My state rep, Christina Bohannon, had run for Congress. Tough three-way primary, and the support of the Unity Coalition was really important for me for making it out of that primary, and so I appreciate it. I've now served in the legislature for 2 sessions. I think, unfortunately, there are 2 sessions where we've seen really the danger of the Republican trifecta and how disastrous it can be for our state. Whether it's, the first vote I ever took against the vouchers bill, taking public money and putting it into unaccountable private schools, all the things we've seen with that last summer, speaking out and voting against the abortion ban, which is taking effect today, and already today hearing about just how horrible that's going to be for many people in our state. I'm also proud to have gotten some stuff done in my time in the legislature. So this year I was the only Democrat to pass a bill with a lead Democrat sponsored. So I serve as the ranking Democrat on the House Natural Resources Committee. One thing that I had heard from a lot of folks when I asked people about our state parks was difficulties accessing opportunities for people with disabilities. And so I was able to get legislation passed this year requiring the Department of Natural Resources to do a survey of what opportunities exist for people with disabilities, to create new resources online and in brochures to make sure that folks with disabilities can access the resources that are available. And then we were also able to get about $1.6 million into the state budget to improve accessibility upgrades for our state park system. That's something I've been really proud to work on. We've also worked a lot on voting rights. And so one thing I'm really proud of, we found, it was reported in January of this year that Iowa's Department of Health and Human Services has been failing to comply with something called the National Voter Registration Act. That federal bill passed in the 90s, requires that state Medicaid operations offer voter registration to everyone who applies or reapplies for Medicaid. What we found was that Iowa was not doing this. Instead of including a voter registration form in the packet they send to people, they were including a printed out link to the online PDF, which, a lot of poor folks who qualify for Medicaid do not have access to printers. And what we saw was voting rights suffer. So Iowa has been doing about 30 times worse than the average state at registering people to vote through Medicaid. And so it took a sort of public pressure campaign and private pressure campaign. But we, here in August, the new form is going to go live. And if Iowa performs like any other state, I'm expecting that 30 to 40,000 low-income people every year will register to vote who previously would not have had voting access until I took on this fight. And so those are some of the things I've worked on. Really, my goal this election cycle is to help Democrats take the majority, because I'm really proud of my track record in the last 2 years, but we obviously need more seats to be able to work on some of the issues that are most important to me.
Well, thank you, Adam. We're going to hand it over to Patrick Borchak. Patrick's our chair of our election endorsement committee and also sits on our board. Patrick, so the floor is going to be yours for the next 5 or 6 minutes to ask 2 or 3 questions. whatever time permits, and we'll give the last minute or two to you, Adam, to close it up. Patrick?
Thank you, Mitch. Hello, Adam. Welcome. Thank you for joining us this evening.
Thank you.
So you received the questionnaire, you returned it, and we as a committee reviewed it, and we have a few follow-up questions for you. So the first one is question number 3 of the healthcare section, which asked if you, given the absence of federal legislation guaranteeing healthcare at the national level, whether you're in favor of Iowa passing a universal single-payer healthcare law to cover every Iowan, including coverage for mental health, dental, vision, hearing, reproductive, and pharmaceutical costs. Your answer was that instead of this approach, you'd prefer to, 1, focus on ensuring that everybody who qualifies for Medicaid be granted access to it through improved enrollment, and 2, expand the Medicaid services. So please tell us now which Medicaid services don't currently exist in Iowa that you would like to make available through this expansion of services.
Yeah, I think a couple that stand out to me here on the eastern half of the state, because of how low Medicaid reimbursements are for pediatric dental care, the University of Iowa is actually the only provider willing to provide dental care for children. And so what you see is that, a parent in Keokuk, 2.5 hours away, may have to schedule an appointment 6 months in advance because they're very short on appointments. Take a day off of work, drive 5 hours round trip just to get their kid a checkup. That doesn't make sense. And also, it's really a problem for the dentist in Keokuk who really wants to have that business. And so we absolutely need to make sure that Medicaid in Iowa is provided to people at an actual rate where they can get basic services like pediatric dental care, which we know is one of, the biggest return on investments you can make. I mean, if kids don't have access to dental care, there's a whole line of problems down the road. This year, finally, postpartum care was expanded to 12 months, something that Democrats have been working on for a long time. But in order to make it, to do it without, spending more money, Republicans insisted on lowering the eligibility gap. So we saw, that thousands of women in Iowa will lose their access to postpartum care. I think we need to fix that. And we really need to make sure that Medicaid in Iowa is a service that we're proud of, and that actually covers the needs of everyday Iowans. When we talk about the enrollment gap, I mean, I'll just give you one example. Since the public health emergency ended, 180,000 Iowans, about 5% of our state, has lost access to their Medicaid coverage. Many of those people still qualify, but our state has not done enough to ensure that they actually reapply and receive those benefits. Governor Andy Beshear from Kentucky, who was here on Saturday when all this happened, applied for a federal waiver to ensure that not a single kid in Kentucky lost access to their Medicaid. Iowa could have done the same and chose not to.
Okay, thank you. So now moving on to workers' rights. So question 1 of the workers' rights section asked if you support enacting a state minimum wage of $20 an hour or higher, indexed annually to inflation. You answered that you've co-sponsored legislation in 2022 to raise the minimum wage to $15 an hour, and that you'd be in favor of indexing it to inflation. You further stated that with cost increases since 2022, phasing into $20 an hour may be more appropriate. So our follow-up question, it's a two-parter. Our 1, was $15 an hour sufficient in 2022? And 2, how long of a phase-in would you anticipate to get to $20 an hour?
Yeah, I think, look, I mean, I don't know if you can say $15 is enough. I mean, obviously the case is that if you're an Iowan, working 40 hours a week at $15 an hour, that's still, someone who is gonna struggle. And so I understand that. I also think, we haven't done it since 2007. Our current minimum wage is $7.25. And so the really important thing to me is to find a way to start the ball moving. And if the way to do that is to do 15 with the cost of living adjustment, or if it's to go straight to 20, I don't know what the best strategy is there. But I do know that absolutely something has to be done, because 725 is not what it was in 2007.
Okay, how much time do we?
Patrick, Adam, we have 3 minutes left, actually 3.5 minutes left, so.
Okay, great. Let's move on to the environment. Okay, so question number 3 of that section, ask what limitations should be placed on the use of eminent domain for pipelines, wind turbines, and so forth. You answered that current limitations are sufficient. So in light of the approval just last month of the CO2 pipeline to pass through Iowa, please explain your answer that the current limitations are sufficient.
Yeah, look, I think for me, you can debate whether or not you can debate whether or not the Iowa Utilities Board made the right decision, and whether or not these carbon pipelines are in the public interest. And I wasn't there for those hearings, and I haven't seen all the evidence on both sides, but I do worry about some of these new restrictions on eminent domain that have been proposed, and the simple reason for that being that I truly believe that we need to make big investments in our state to fight climate change and to transition towards the future. Carbon pipelines are not going to be sufficient to get us there, and who knows how big their impact actually is. But when we talk about updating our grid, when we talk about increasing access to wind and solar, those are going to take big investments that move quickly. And so we have to think about how we can create a regulatory framework that allows those projects to move forward. We don't want to, hold things back so much that we're stuck with coal.
Patrick, Adam, we have 2 minutes remaining. So we probably should close it up with giving Adam a couple minutes to talk about his follow-up on his campaign.
Thank you.
Yeah, thank you. I've been really proud of my campaign this time. Some of the things that I'm really focused on getting out into our swing districts, because at the end of the day, if you care about young people, about the future of our state, public education and abortion access are going to be the 2 most important issues in this election. The only way we get there is by picking up seats in the Iowa House. Another thing my campaign is really focused on is voter registration. Every year when the students get here, we start doing large amounts of voter registration. In the last 2 years, we've been able to register well over 1,000 students through those efforts, and that makes a huge difference in this district and beyond. And it's really important to me that those students know that they have a voice and that they're able to participate. And yeah, I'm really looking forward to looking at the next legislative session, and we have a lot of work to do to fight against just the horrible steps backwards we've seen in the last couple of years from our Republican legislature.